Okay, so Grampians BreastScreen covers the region of Maryborough, Horsham through to the border, down to Ballan to Hamilton. And also in the Western Victoria PHN region, there's another BreastScreen service, which is Geelong BreastScreen, and that's auspiced by Lake Imaging. So I'd like to acknowledge the traditional custodians on the land on which we're meeting today and pay my respects to elders past, present and emerging. And for us here in Ballarat, it's the traditional landowners are the Wadawurrung people. So I just thought I'd go through a little bit about the BreastScreen program, talk a little bit about screening for people with a disability. There was in 2018-19 a significant project between BreastScreen Victoria and Cancer Council of Victoria. So I'll just share a little bit of a summary of that project, which has informed the way we deliver our service, and then some time for questions. So who's at risk of breast cancer? 1 in 7 women. So really common form of cancer for women. And most women who get breast cancer do not have a family history. So age is the biggest risk factor for developing breast cancer. So when we look at the 2 options for diagnosing breast cancer, there is the early detection road of BreastScreen services. And the reason we target the age group of 50 to 74, but clients can screen from 40 years onwards, and that's really to have the maximum impact from the screening program. You don't need any referral, it's free every 2 years. It's a mammogram. It's quite a simple mammogram. We do 2 X-ray pictures of each breast, so one from the top view and one from the side view on each breast, and we send the results to the client and their GP. So BreastScreen services are for people who don't have any symptoms, no breast lumps, no discomfort in the breast, etc. If people have symptoms, they're encouraged to go down the diagnostic pathway, which is can be for any age. You need a referral from usually a GP. Go to a diagnostic service, and it's either bulk billed or Medicare rebate, and it's when required. And people usually get the results, or the results go back to the GP within usually a day. Breast screening, because we're for asymptomatic clients, the results are usually not provided to the client or the GP for maybe 2 to 3 weeks. So we're not about prevention. We don't prevent cancer, but our job is to get it early when it's small, and we can detect very small cancers. We even detect precursors of cancer, so before people have cancer. So obviously the early detection offers a better chance of successful treatment and recovery, and less invasive treatment. So just to show you, there's about 46 places across Victoria where people can screen. And although we have fixed sites, for example, in our region, we've got a fixed site in Ballarat, we've got a fixed site in Hamilton now, it's just opened, and Horsham. But we've also got the mobile screening van, which goes around the region. And this map's a little bit out of date because we've got Ararat, and we're hopefully going to Daylesford, and we've started going to some of the ACOs as well. So the mobile screening van is a way of also making our service more accessible. So what actually happens? Well, for every 1,000 clients we screen, 955 will get a letter from us saying the X-ray image, which is read by 2 radiologists, there was no signs of breast cancer seen. But 45 will contact and we'll bring them back for further tests. And those further tests might be another mammogram, but it may be a 3D mammogram, magnified views, ultrasound, maybe biopsy, physical examination with a surgeon. And of those 45, 39 will get the all clear result, but 6 will go on to be diagnosed with breast cancer on average. So in our region, I think we screen, this is in the Grampians, over 13,000 clients, and last year we had over 100 positive diagnoses. This is the BreastScreen Victoria results. So 250,000 clients are screened, and you can see that they had 1,500 across Victoria positive detections. And to note that the 309 were ductal carcinoma in situ, which is pre-invasive cancer. So, you know, really, if you find some of these cancers and pre-cancers early, then less invasive treatment. So we've got some priority populations and underscreened populations that we know and are aware of that face systemic barriers to participation in national screening programs. And I should say that breast cancer or breast screening is one of the 3 national cancer screening programs. So there's also bowel and cervical cancer screening programs. So you can see that people with disabilities is one of the priority populations, and obviously, as per your project, you know that's it's not one size fits all. There are all sorts of different reasons why people would have a disability and may have more than one different type of disability as well. So most eligible Victorians with a disability are able to have a breast screen. However, for some, other tests may be more appropriate, and it's probably important for people to talk with their doctor before having an appointment with BreastScreen. Just to do a little bit of a summary about the project that was done a couple of years ago now, the findings of the needs analysis, this is quite a big project, but I've just really got it to a couple of slides. For breast screening, the BreastScreen Victoria gets off the electoral roll. People who are women who are have reached 50 years of age, and we invite those women to participate in breast screening. So, you know, one of the barriers may be that people with intellectual disability may not actually be on the electoral roll. So, you know, that's one of the limitations. The limitations of our equipment. We can screen for people who are in wheelchairs. I'll show you a little bit later a special chair that we've got to help with people with a physical disability to participate in screening. But people do need to hold a position, so it's important that they can follow instructions. And also, we always check in with our clients to see if they're comfortable, it's not too painful, and so people need to be able to communicate with us when if the screen has become too uncomfortable for them. We do need to do some compression on the breast. It's just firm pressure. It's uncomfortable. For most people, it's not painful. However, you know, it may be for people with an intellectual disability too painful. And we do see some of our clients, they will pull away from the machine, and sometimes that's really withdrawing consent to participate in the screening program. And obviously for clinicians, just in being sure that they've got that informed consent. And the other barrier is competing health priorities. Now, the project did a whole of systems approach, so there was lots of different advocacy, lots of different data collected, lots of engagement with consumers, and there was also training of health professionals. So the actual project was quite comprehensive. In terms of engaging with the community, there was a lot of work done on building capacity, peer education, and lots of resources were developed. So there's a booklet that we have, which is online, and I've sent to Kerry and Nicole. So it's a storybook for people who are invited to screen, particularly targeted for people with a disability. So Lisa's story is a resource for breast screening. We've also got on our website, and I've sent this is a fact sheet about screening for people with disabilities. So I've shared that with Kerry and Nicole. There's also resources for GPs, so I've sent that to Kerry and Nicole, and it also applies to other health professionals, things to considerations for having the conversation with someone with a disability about their suitability for breast screening. And then at Grampians BreastScreen, as with all BreastScreen services across Victoria, we all do training in screening for people with disabilities. We've also got, as I've gone through some of those resources, we've done disability access audit and implemented some changes. You can see the picture there. That's a mammography chair that we purchased last year, and it enables our radiographers, there's two of our radiographers there, to have the client be able to sit in that chair, and it goes up and down, the arms come back and forth, come off or fold down. And so it helps for people who've perhaps got physical challenges to hold a position, to get in position. And it also is useful for people who perhaps need to have a seated mammogram, but when we offer a wheelchair, it's very low, and so this chair can go up, so it's better from an occ health and safety point of view for our radiographers. We can also do screening for people in wheelchairs as well, in their wheelchair. At the time of making an appointment, we ask about people's disability and note any of their special needs. And we can make our appointments. We do have longer time appointments. We have appointments where we have 2 radiographers present when required. People can come with a carer, an assistance dog, and we're very, very happy, and we very much welcome people to come as a client or with a carer or as a group to do a tour, and we're happy to show people around our facility, and we're also happy to do group bookings as well. So people come for a group, and they might do some other activities on the day, but come on a bus and we'll do group bookings as well. And that's pretty well common for all breast screening services across the state. So I mentioned that some of the challenges are that positioning, so people need to have that physical ability to hold that position, and also follow instructions and be able to communicate with us if there's if the compression is too much for them. And so that consent. And one of the things that we occasionally find with people with an intellectual disability is that they will pull away from the machine, and we take that as withdrawing consent. And so for those clients, we will communicate with them and their carer and their GP that maybe an alternative pathway to the BreastScreen program might be more suitable, maybe having regular ultrasounds or regular physical examinations may better meet their needs than the BreastScreen program. And the other thing is that we've got a consumer network, so I'm just giving a plug for that. Obviously, we want people from as many diverse backgrounds to be part of our consumer network, and so and to better inform our service so that we can continue to improve. So we would welcome people to join our network and get involved in providing us with feedback and making decisions about how we might offer the services. Any questions? And I suppose just to give a plug, to make an appointment, you can either ring the 132050 number or get online and make a booking online.